Evening. Assalamu alaikum. My good viewers, we have today our fourth health video. This is a health video about diabetes care. Thank you very much for subscription and also increasing my views on because I have different types of videos. So I request you to please subscribe this channel. Today we are going to discuss 8 ways weight loss can help control diabetes. Okay, so when you are overweight, your diabetes cannot be controlled, and you especially I'm talking about A1C test. So when you lose your weight, your A1C test will be better, and your diabetes will be better controlled. So losing 5 to 10% of your body weight that may help you better manage your diabetes 2 type and keep blood sugar under control, especially for A1C test. This is today our guide for health. I think maintaining a health weight has its obvious health benefits, okay? But it can also help you better manage type 2 diabetes. Losing weight can bolster your blood sugar control and lower your risk for diabetes complications like high blood pressure and plaque built up in arteries, according to Center for Disease Control and Prevention, CDC in America. Nudging down the number on the scale by just 5 to 10% has been shown to help some people reduce the amount of diabetes medication they need. But diabetes medication is not the solution for everything, because on one side you are taking diabetes medicine, on the other side you are reducing many things, because there are side effects of everything. It's better to manage your health by exercise, by eating diabetic food, healthy food, and also your medicine, continue your medicines. So I think weight loss, that is one of the major issue. Some will reduce the amount of diabetes medication they need. Okay, that is according to a diabetic care published article I read, the modern research team. Weight loss is very high on the priority list. We try to understand, especially for the people, those who are on diabetes 2 diabetes. This is said by John Brinker in RDN and CDCES. Okay, that's he's the director of practice and content development at the Association of Diabetes Care and Education Specialists. Okay, in North California, USA, and also he's a spokesperson of that organization. He admits that dropping pounds isn't or kilo in the weight isn't easy, but when you succeed, you will reap a host of health benefits. Read on. The new and modern research in Germany says when you reduce your weight by making a mind that you have to reduce less, actually your diabetes, you are controlling yourself without, and that needs less insulin, that needs less diabetes pills, and also it will, most of your organs will be saved. So now the question does arise, how you can improve insulin resistance? That's also one of the big things. When you lose your weight, your insulin resistance is better. When you do not lose weight, your insulin resistance is not better. So this is, you have to understand, that's a scientific trick. Diabetes 2 diabetes, your body doesn't properly respond to the insulin. That's one of the reasons you must understand, produced by pancreas, that is the increase, and your blood glucose level goes up. According to National Institute of Diabetes and Digestive and Kidney Disease in USA, they say that this is called insulin resistance, and it's often linked to excess weight. When you have too much weight, you don't have insulin resistance, okay? Then insulin resistance becomes less. So having that weight loss will actually help make the body more sensitive to the insulin and allow that insulin resistance to decrease. You try to understand, this is what insulin resistance is doing with your body. when you are overweight. Okay, and then another scientist, Julie Malinowski, she works in Alice Medicine in Schenectady, New York, USA, as a good researcher and doctor. She says your body becomes more efficient, can use the insulin more easily. And she explains, according to previous study, insulin sensitivity seems to improve as a result of weight loss because the inflammatory responses in the muscles decrease. So that's very important, that your response, inflammatory response in the muscle decrease due to weight loss. When you have more weight, your inflammatory responses in the muscles increases. That's one of the reasons you have to lose weight for good resistance of insulin. Okay, so I think and as a result, when insulin resistance goes down, that's good thing for diabetic management, and your A1C is better. Now the question does arise: how when you're overweight, your A1C test is not better, but when you are not overweight, your A1C is better. How it starts improving? Okay, one of the research in Pakistan says that 10 to 15% weight was reduced, and A1C results, those who are having above 15, it decreased to 11 to 13%. 11 to 13. So you try to understand 11 to 13. So the target is 7.5 maximum, because maximum we told more than 7.5 can be horrible, because it's going to touch the organs of the body. So now we can think about better A1C results with low weight. Since insulin sensitivity improves with the weight loss, you understand, you will see better results when your doctor does an A1C test. Okay, an A1C test provides a picture of your average blood glucose levels over the previous 2 to 3 months. Okay, usually it's 90 days. Now you have modern machines. For example, you have One Touch, the latest one, that has the function. When you check your diabetes, you can also check A1C of 90 days maximum. Also, you can check in the same machine. Now, 60 days, you can check in the same machine 30 days, and also you can check 15 days and 1 week also. So this is because new technology is improving. So that is in One Touch Select 2. This one is included now, that if you cannot go to the hospital for blood test for A1C after 3 months, just when you go, and even you are checking every day your blood sugar test in the machine, you can every day check how much you have 1 month, how much you can have 2 weeks, 1 week, 2 months, and also 90 days. When you go there, you will see the same results as the machine is showing you. There will be slight differences, not more than that. So a review of studies published in August 2016 in the journal Obesity Review found that people with diabetes type 2, who participate in Jenny Craig and OptiFast weight loss under Nutri-System, okay, saw their A1C levels go down after 6 or 12 months, depending on the plan. This is why lifestyle change through diet and exercise is the best treatment for type 2 diabetes. Says Dina, she's the MD doctor, so she's an assistant professor of medicine, endocrinology, diabetes, and bone disease at the Icahn School of Medicine and Mount Sinai in New York City, United States of America. So how can we go? This one, which I explained, it is related to the research 5 days to lower your A1C. Okay, the 5 ways to lower. This I told you. Low blood pressure and improved cholesterol also. It's not only that when you have obesity, you are more weighty. Okay, you have problem of A1C, When you reduce your weight, your A1C goes down, but also it lowers your blood pressure and it improves your cholesterol also. Heart trouble and diabetes are linked. You must understand these two things. And high blood pressure and cholesterol levels are common conditions among people with type 2 diabetes. Okay, this is said by CDC. High blood pressure can end up damaging artery walls. Okay, and having too much LDL. LDL we can say bad cholesterol, and triglycerides cholesterol, that is another blood fat, can lead to build up, okay, on the damaged artery walls and further complications. This type of bad cholesterol, you see, if it's above limit, it can anytime block your vein, okay, and that can be a cause of a heart attack, or that can be a cause of a clot. So that's why it's too dangerous. Uh, People with high diabetes, they have risk of heart attack and they have risk of clot. So they should, after every 3 months, check their A1C with cholesterol. So LDL should not go up. You try to understand. Bad cholesterol should not go up. That's called LDL. And also triglyceride, that's total cholesterol, should be less. Okay, it's better if it is 400 total cholesterol. It's not going 600 or 700. That's too much. Okay, so excessive weight adds to the problem. You try to understand. This is the talk today. We have to go diabetes for healthcare, for our health guide. Obesity is known risk factor for high cholesterol, high blood pressure, and also coronary artery disease. You see, after every 1 year, as a diabetic patient, you must have to go for a fundus test of your eye, because when the sugar level A1C is not good, you are getting more than 7.5. This means that excessive sugar will touch your cornea. So slowly your eyes goes down. You see your vision goes down. One day you go to the hospital and they have your fundus test and they tell you, when you see the cornea, they show you your picture of eye and they show you, sorry, you have lost 10% eyesight from this eye, from this eye. So to avoid this, I think you must be able to care. A1C should not more than 7.5. Okay, it's better if you keep it at 7. 6.5 is the best one. But losing weight can lower your risk. In a study of 401 people who were overweight or obese, those who lost 5 to 10% of their body weight significantly lowered their total cholesterol, okay, triglycerides, and also LDL cholesterol, in bad cholesterol, triglycerides, and total cholesterol. They also lost when they lost their weight. Those who lost more than 10% saw even more improvement. Okay, according to this study, which was published in September 2016 in the Journal of Translation Behavior Medicine, high-risk patients also significantly lower their fasting glucose level. So this is very important to save you from your high blood pressure, from coronary disease, eye diseases, okay, and also cholesterol. Avoid the risk of heart attack and avoid the risk of clot, because you should not be a victim of paralysis. Okay, if the body is paralyzed, there is no life. Another reason to work on, I'm talking now about this decreased risk for vascular damage, because I was talking from cholesterol to, A1C to cholesterol to coronary disease, and now there's some continuing. Another reason for work on weight loss, you must work with, what is the other reason? Obesity and insulin resistance are associated with vascular inflammation. Another research published in April 2014 in the Journal of American Geriatric Society, as obesity progresses, cells in the body that store fat, okay, they are called adipocytes, okay, become enlarged and stressed, which can increase inflammation, Okay, this is also proved in other research in 2018, article published in Circulation. Okay, this can lead to uh, arthrosis, a disease marked by the buildup of plaque in the arteries, according to the Natural Heart, Lung, and Blood Institute. Exercise and weight loss. These are two important things. You try to understand. Exercise is linked with the weight loss, lower insulin resistance. So one of the things when your insulin resistance, you see, and also can lead to a reduction in the amount of a certain molecule found in blood that's involved in inflammation. Okay, according to the aforementioned Journal of American Geriatric Society study. So this means when you are exercising, you are losing weight. Even walking is good. When you're walking, you're losing weight and your body is less, and you're not having obesity. If you have regular walk of 3 kilometers to 10 kilometers daily, you are not overweight. Your obesity will reduce and your sugar level will be better. So also another thing is related with your, when you lose your weight, you don't have obesity. It is also sleep. Your sleep is improving. You try to understand. You do not work hard. You do not go for exercise. You do not go for jogging. You're not losing weight. So that's, I'm connecting it to reduce risk of sleep apnea. What is sleep apnea? I tell you. Diabetes also heightens the chance you will experience sleep apnea. A sleep disorder that presents as abnormal breathing during sleep, according to Sleep Foundation or organization. Uh, you can check their website also, sleeporganization.org. As many as 71% of adults with type 2 diabetes have obstructive sleep apnea. Okay, according to research published in Frontiers in Neurology, that in that included data from 5 studies, the researchers found that weight loss can improve obstructive sleep apnea. So this means weight loss is good for you. Your sleep will also be improved. And what's more, according to the American Academy of Sleep Medicine, sleeping well may help you get better control of your blood sugar, since sleep loss leads to increased insulin resistance. So your insulin resistance will be better. You will improve your sleep. You will reduce your weight, and also A1C will be better, and blood glucose sugar will also be under control. Sleep loss can hurt diabetic management in diabetes management in other ways. How, according to one journal, I think according to Harvard School of Public Health, okay, the full name of this school is Harvard T.H. Chan School of Public Health. They say not sleeping well can zap the motivation to exercise and increase hunger because of hormone disruption, and poor diet and lack of exercise further exacerbate problems with blood sugar control. Also, this was told by Mayo Clinic. Okay, so these are very important things when you have good walk, good exercise. If you are a student, you, after study, you go for a club, you play football, you play volleyball, you play cricket, or you go to gym, you have exercise, or you are regular having walk. So you don't have the risk of diabetes. Your diabetes will be under control. So also, it increased mobility also very important. According to previous studies, many studies they say, okay, people with type 2 diabetes are twice as likely to have mobility related issues as people who do not have the disease. The study authors noted that mobility related issues increase as the level of obesity and physical inactivity increases. People with diabetes also often have bone and joint issues, okay, which can limit activity, whether because of nerve damage, obesity, or arterial disease. According to Mayo Clinic, the good news is that losing weight will likely make day-to-day activities easier and help keep mobility-related issues at bay. You go bay, you go ground, you go walking tracks. In this case, even if you're in the kitchen you are working, okay, when you are doing gym, mobility is necessary. A little weight loss can go a long way. The researchers behind the study found that losing 1% of body weight increased an individual mobility problem by more than 7%. You have 1 kilo, if you reduce and your weight is 99 kg, 7% mobility will be increased. Some of the diabetic patients, they cannot say prayer properly when they have to go down for sajda and in ruku, they feel difficulty because this is diabetic neuropathy affecting on their neuro. So for those type of patients, exercise, okay, walking is better, losing weight is better. Then increase energy and improve mood also necessary. When you are losing weight, your energy is increased and your mood is improved. Okay. Rinker says, I think there is one, already I discussed one research. She sees it time and again when people lose weight through a healthy diet and exercise. Their energy level goes up and their mood improves. Okay, according to CDC, losing weight and keeping it off leads to improvement in self-confidence too. Weight loss can really help our mental health. Yes, mental health, because people feel better about themselves and better about the choice they are making. Okay, and also Rinker says that this boost may give people motivation and better management their diabetes and continue their healthy habits. Okay, you are not lazy, you will not feel dull, dreary. Okay, and doomed. No, you will be healthy and you will be active. So also, when you are losing weight, delay in disease progression, that's also one of the point. For the 88 million Americans with pre-diabetes in more than 30% population in India, 17 and above population in Pakistan, I think many countries also have, other countries also have population of diabetes because it has become a word dilemma, a term used for people with higher than normal blood sugar levels that aren't high enough to be type 2 diabetes. Weight loss can lower the risk of advancing to type 2 diabetes. So losing weight can help to reduce insulin resistance and may even delay or prevent complications from arising. So a certified diabetes care and education specialist can give you good advice. Wherever you go, they will first say, lose your weight if you have only obesity, okay? But what about for people who have already been diagnosed with diabetes? If you're not diagnosed, even then they will say. So when you're diagnosed, then it becomes a compulsory for you to have good weight. If your height is 5 feet and 8 inches, the doctors say you should have ideal weight is 77 kg. This is one example I gave you. A study published in 2016 in Diabetes Care found that 40% of study participants who lost about 33 pounds and maintained that weight loss for 6 months were able to send the condition into remission. So that's very important, and that will be the solution for diabetes. Okay? It should be noted, however, that this doesn't mean diabetes just went away. No, diabetes is there. It's a chronic disease. Diabetes cannot be reversed, but it can go into remission, meaning the signs and symptoms are reduced. Okay. Unfortunately, the changes aren't permanent. If somebody who is in remission goes back to their same unhealthy eating and drinking habits, then diabetes can come out of remission and flare back up. I say this is a type of lion in your body. You have to soothe the lion in your body. Okay, that is, shouldn't allow lion to angry and to eat you. So making the most weight loss have a lot of benefits. I told you, you must understand in general. I recommend, I say, choosing lifestyle changes you can sustain rather than relying on fad diets for weight loss and weight management. I can suggest starting with the pillars of healthy eating, adding more fruits and vegetables to your diet, as well as lean meats and plant-based protein, and limiting processed foods and added sugar. It's better not to add sugar, okay? If you cannot live, then you can use sweeteners, okay? before you know it, you will be a pro at managing your weight as well as type 2 diabetes and its complications. If you know, you go to doctor, they say you are pro-diabetes, pre-diabetic, so you should avoid. Even then, you should avoid. If they say you are diabetic now, then it's compulsory for you that you must reduce your weight at a certain level, what the doctor will tell you. Okay, and this is everything for you. Don't forget to subscribe my channel. And people with diabetes, they will start losing weight from today. I hope so for their better health. Thank you very much, and don't forget to subscribe this channel. Inshallah, next video will be again on very good health guidance. Thank you very much, and bye bye.